Okay.
Should I open the same link? You can be also. Or it will make noise.
Yes.
Okay. Let's start by Fatiha and then we go ahead.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. My name is Patricia Huda. So today I would like to share about missile. Okay, so this is the table of contents. So okay. So start with the introduction. So measles is a highly contagious infection that occurs worldwide, caused by measles, or also known as the rubella virus. So regarding the rubella virus, it is a single-stranded RNA virus that has two membrane envelope proteins. So its family is Paramyxoviridae and its genus is Morbillivirus. Humans are the only natural hosts and are also present in the respiratory secretions, blood, and urine of infected person. So for mode of transmission, the virus is transmitted by direct contact with infectious droplet or by airborne spread when an infected person cough, sneeze. So for the epidemiology, measles persists or remains endemic in countries around the world where the measles vaccine or MMR is not available. Despite that, between 2000 and 2018, the global mortality toll from measles decreased by 73% as a result of vaccination. And according to WHO, an estimated 23.2 million fatalities were averted between 2000 and 2018, making the MMR vaccine one of the best investments for public health. And in Malaysia, based on WHO immunization data, there were 128 reported cases in 2021, declining from 1,077 reported cases in 2019. While for measles vaccination coverage in Malaysia in 2021, the first dose is 69%, while the second dose is 84%, which means the majority of children in Malaysia are immune to the disease since the establishment of the measles immunization program. And furthermore, since measles is still endemic in some regions, travelers are more vulnerable to getting infection. So they might want to make sure standard vaccination like MMR are updated. And in addition, measles is still widespread in underdeveloped nations, notably in areas of Asia and Africa, due to overpopulation, malnutrition, and insufficient healthcare. So next is the pathophysiology. So infection is usually spread by respiratory droplet, which are secreted by infected person when they cough or sneeze and remain airborne for up to 2 hours in enclosed space. So thereafter, localized infection will develop in the tracheal and bronchial epithelial cells of the respiratory tract. And after 2 to 4 days, the measles virus start to infect local lymphatic tissue. Then before the rash appears, the cell-associated transmit the infection to different organs like bone marrow, liver, spleen, and vascular endothelium. So from that, measles will cause generalized immunosuppression at the onset of the rash, which means there is reduction of the immune system, and which could lead to an increased susceptibility to secondary infection. So this is the clinical manifestation. There are 4 phases or stage. So the first is incubation period, which is 8 to 14 days from exposure to symptom onset. And then begin with the incubation period, which lasts between 8 to 14 days. Then there is also prodrome phase, also known as the catarrhal phase. It's characterized by 3 days. It's characterized by high-grade fever, cough, coryza, conjunctivitis, and at around this phase also complete spots are also visible. So prodrome phase will last 3 or 4 days before the rash develops. So next phase is exanthum. So maculopapular rash arises and spreads over the rest of body within 24 to 48 hours. And after about a week, the rash start to disappear during the recovery phase, and discrimination and brownish discoloration show up. So next is the symptom and physical finding during prodrome phase. First, the patient will experience high-grade fever, persistent cough, runny nose, red and watery eyes, malaise, and sore throat during the prodrome phase. Also, for the physical finding, during the prodrome phase, it usually appear complete spot usually appear as a gray-white spot on the buccal mucosa or on the inner lining of the cheeks. Then the rash starts out as this discrete, but later on, especially on the face or neck, it may become confluent and spot patchy. Also, and then it will fade as cutaneous rash appears. And then for exanthum phase, maculopapular rash first appears on the face during the exanthum phase, primarily on the forehead, in front and underneath the ears, and also on the side of the neck. And then lesion will spread quickly throughout the extremities, including the palms and so within 24 to 48 hours. Then the rash start out discrete, but later on, especially on the face and neck, it may become confluent and patchy. And then next is the investigation. So when a patient develops cough, conjunctivitis, and coryza after the exposure, measles may be suspected for investigation. However, doctor often only done it after the rash show. So usually clinical diagnosis is made by detecting complete spots or the maculopapular rash. However, for some laboratory results that we can get from the patient, first from the full blood count, which is leukopenia, and then for the purpose of confirming measles infection, there is serology testing and RT-PCR, which is real-time polymerase chain reaction. For serology, it can detect IgM-specific antibodies in blood or oral fluid. And for RT-PCR, it will detect measles RNA from respiratory specimen. And next is the management of measles. So basically, there is no specialized antiviral medication available to treat the measles virus, but due to measles is highly contagious and contaminated droplet from infected people can spread through the airborne. So the patient should be quarantined and require hospitalization. And then through supportive treatment, dehydration also need to be treated by maintaining the fluid intake. And then according to WHO, vitamin A supplements are suggested because it has been demonstrated to lower measles-related morbidity in children. And then because measles can cause children's low vitamin A levels during the infection. So the children that infected need vitamin A supplement. And then for another treatment, antibiotic for the patient that got bacterial infection like conjunctivitis, otitis media, or pneumonia.
It's secondary.
Secondary bacterial infection.
It's not a pathogenesis. Secondary.
And then for prevention, as we know, with a measles-containing vaccine, which is typically given as the combination measles, mumps, and rubella vaccine. So measles can be avoided. And according to pediatric protocol, the MMR vaccination is advised to be given at 9 months of age for the first dose and at 1 year of age or for the second dose. While in Sabah, the measles vaccine is administered at 6 months of age. And for post-exposure prophylaxis, the vaccination should be administered 3 days after exposure to susceptible contacts in order to prevent the disease. The next is the differential diagnosis. So the first is rubella. Rubella, are also known as German measles, is an infection by the rubella virus. Constitutional symptoms are absent or mild, and it has lymphadenopathy and rash. And then for roseola infantum, which is caused by human herpes virus 6B, the rash resembles measles, but it seldom occurs in children more than 3 years old. And then Copic spot and malaise are absent. Next is infectious mononucleosis, which is caused by Epstein-Barr virus and is characterized by fatigue, fever, pharyngitis, and lymphadenopathy. And then scarlet fever is a bacterial illness that develops in some people who have strep throat. So scarlet fever features a bright red rash that covers most of the body. And then rickettsia, which is caused by a usual type of bacteria that can live only inside other organisms like lice, mites. And then the last one is Kawasaki disease. It commonly leads to inflammation of the coronary arteries. It is characterized by prolonged fever, exanthum, conjunctivitis, and mucous membrane inflammation. So all of these are got rash as their feature, like how we want to know the provisional diagnosis is by doing the investigation. And last thing is the complication of measles. So for the head or neurological system, first encephalitis is the most feared complication in an immunocompetent children, as it can cause permanent brain damage. And another one is otitis media, an infection of the middle ear, which is one of the most common complications. And for the respiratory system, it can cause bronchopneumonia and bronchitis. And for the cardiovascular system, it less commonly causes myocarditis. And then it also can affect gastrointestinal system, which can cause some complications like gastroenteritis, appendicitis, hepatitis, and diarrhea. And then in hematological, hemorrhagic measles and thrombocytopenia can happen. So I think that's all for measles. Is there any question?
You need to ask any questions.
For the investigation, You mentioned that it's usually done after the rash. Why is that?
Because other symptom, symptom is not, it's like constitutional symptom. So the parents or doctor will treat it by treat it like another disease. But if there is rash, so doctor will start doing the investigation.
Yeah, this is an important presentation. We must know that some diseases are notifiable. Like this, you must inform the minister within 24 hours, which are very important because this is public issue. And preventive control are very important for us. We need to take now an idea how the viruses can be translated. We will speak about COVID and another virus, but this virus usually by droplets. Because you must know how is the size of the droplet, what is the size of the airborne, like that. The immune system play an important role in the defense against all viruses. That's why the child with malnutrition is chronic disease. Like this, he is not, we say he is immune compromised, but he is relatively immune compromised. So we must take care about that. Okay. Another clinical point, if you come back to the clinical presentation. Yeah, you must have a high index of suspicious. Okay, because you are going now to start your clinical pathway after graduated from the basic medical science. And you have maybe 1,000 days plus. It is not a big number of days to practice medicine. So you must every day. You must put a lot of new cases, and in every case, as your colleague present, we must think about 10 cases beside it for its differential diagnosis. So we need to start by the art of differential diagnosis from now. Is it measles? Why not another disease like German measles? Why not like and she good for you about 4 or 6 differential diagnosis, and we still can add more and more. Okay, this is a very important. Also, to know the sequence of the disease will help me. I mean, if I hear, we hear previously that there was one patient of diphtheria came presented with myocarditis and expired in the ICU like that. So we must be oriented. Some patient come to me with presentation looks like diphtheria. I must be put in my mind. Now, if the patient came with a complex spot, which is the highly point for the diagnosis, it's very sensitive clinical findings. So I would think this is measles, and you must give the family quarantine and they start your working and tell them I need to see him tomorrow. He may progress skirmish. Okay, so it is very important. Because skirmish can come with different degree of severity according to the previous immunization, previous immunity, which are very important. So to know this one, it will help you to able to predict what is going in the future. Am I clear? Mm-hmm. So don't think this is just theoretical knowledge. It is very important, okay? And most of these viruses need only symptomatic treatment. And the most challenging area is the fluids. Because children will not speak. When they feel bad, they will stop feeling. And quiet, and they keep quiet, which is very dangerous. If you find any children like that, you must suspect it has a hidden problem. You find the child are silent and doesn't want to drink or eat, it is a very dangerous sign. Okay. Secondly, bacterial infection can occur after any one of these, but usually it will not start with the initial disease. To go secondary bacterial infection, usually there is a gap between 3 to 5 days. Okay. Thank you for your presentation. Let's go for the second one.
Yes,
You can sit down if it is more comfortable for you. No,
it's okay, you can stand.
okay.
So hello to everyone, my name is Sadatun Najham Tishadan. So I'll be presenting about influenza and H1N1. Okay, so let's go for the important properties of the virus first. So influenza is an acute respiratory illness caused predominantly by influenza A or influenza B. But it also has influenza C and D, which is less dominant. It occurs mostly in annual winter outbreaks because in winter mostly people will be indoor and the transmission is more efficient in winter. And in many children, influenza is acute, self-limited, but in some with with maybe immunocompromised, they will have few complications. So the spread of influenza virus is via droplets, and children are important vectors for the disease in the community. For example, through coughing, sneezing, or touching any objects from mites. Okay, so for influenza, the most common complication is pneumonia. And as for the virus, let's go a bit about the virus. The virus family is orthomyxovirus. The genome is single-stranded RNA genome. It has a helical capsid. And the important thing is the envelope proteins, which are HA and NA, hemagglutinin and neuraminidase. These two are specifically for influenza A. So the classification of influenza, we have 4 types: influenza A, B, C, and D. So let's go for the first one, influenza A. It causes seasonal epidemics almost every winter. It can also cause pandemics. Just for influenza A, the antigenic reaction or the immunologic reaction are antigenic shift and drift. So I'll explain later what is antigenic shift and drift. It can infect human and also animals. There are many subtypes. So one of them is H1N1. As for influenza B, it can cause epidemics also, but it does not cause pandemic because the immunological reaction are only antigenic drift, which are minor mutation. It cannot cause a pandemic, and it is only found in humans. There are also lineages in influenza B, which are Yamagata and Victoria. As for influenza C, it does not cause an outbreak. It causes mild respiratory tract infections and common cold, and it also can infect humans and animals. For influenza D, it primarily affects cattle, and it is not known to infect humans. So, what is antigenic shift and antigenic drift? So, and let's go for antigenic shift first. So, antigenic shift, there are major changes in the HA and NA sequence, which is only in influenza A. So when there are major changes, it can produce new subtypes, and it will produce a new combination of HA and NA proteins, which are different from the existing influenza virus. So because they are different, humans will have less protection towards the virus. So that's why it can cause more complications. So as you can see in the picture, for example, there will be reassortment of virus A and virus B. It will co-infect the same cell. So the cell will produce virus C, which is not the same as the previous virus. So that's why human has less protection against this virus. And that's why in influenza A, antigenic shift can cause a pandemic. Okay. As for antigenic drift, there is only minor mutation, which is point mutation. So there will be amino acid changes and it will escape from immune system. And it can cause only local outbreaks, but not a pandemic because the mutation is only minor. However, although the mutations are only minor, maybe the small changes can be enough to make human immune system no longer recognize them and to defend from the altered protein. So that's why we need a yearly immunization for influenza, because this virus will keep on changing. Okay. So this is one theory proposed how influenza H1N1 occur. For example, antigenic shift occurs when human influenza virus, the blue one, and the avian influenza virus, the red one, will co-infect the same host, which is the swine. So this one will produce a new type of virus, which has less protection in humans. Okay, so that's what reassortment and antigenic shift means. So why is it called swine flu? It is a common respiratory tract infections in pigs worldwide. So at first, the people who are only closely associated with pigs will develop swine flu. But right now, there are also person-to-person transmission because there are efficient antigenic shift occurs, which makes it more like a new virus which can transmit to humans. Okay. The epidemiology of H1N1 worldwide global WHO data for severe infection, 3 to 5 million are infected, estimated death 290,000 to 650,000. In United States, according to CDC data 2018-2019, for infections there are 35.5 million infected, medical visits 16.5 million, hospitalization 490,600. For death there are 34,200. As in Malaysia, there are not much data that is collected. So there are more than 15,000 individuals were confirmed to have infected with this virus during the pandemic. This is according to MOH. So what are the high risk groups for complications of H1N1? The high risk groups are pregnant women, infant and child below 5 years old, elderly more than 65 years old, patients with chronic diseases such as COPD, chronic respiratory disease, CAD, and other chronic diseases. So they are immunocompromised and relatively immunocompromised. So that's why they are high risk groups for complication of H1N1. Okay. Okay. So the pathogenesis of H1N1, so it is transmitted via droplets, and then it will affect the ciliated columnar epithelium, the respiratory epithelium, and then the hemagglutinin will facilitate binding to the cell surface receptor, HA. It will facilitate the binding, and then it will multiply locally, RNA replication, transcription, and it will translate into protein and package, and then before exiting, the NA will cleave the salicylic acid to release the new progeny virus. So after it has been released from the infected cell, it can either cause local damage or it can spread to other cells. If it spread to other cells, it can enter the bloodstream and cause extrapulmonary manifestation, or it can also spread to lower respiratory tract. Okay. So this is how it infects a cell. The signs and symptoms of H1N1 are systemically, it can cause fever, lethargy. Psychologically, it causes lack of appetite. And for the nasopharynx, runny nose, sore throat, coughing, muscle pain, nausea, vomiting, diarrhea, and joint pain. So what are the emergency warning signs in children? So in children, if we notice there are fast breathing or trouble breathing, bluish skin color, dehydration, the patient looks very sluggish, very irritable, or the flu-like symptoms does not improve, or if we notice there are fever with rash, then urgent medical attention is needed. Okay. For physical examination, general examination, the patient might look fatigued, had fever, tachycardic, tachypneic. They has runny nose and pharyngitis. For respiratory examination are positive only when there are complications. For example, there will be dullness on percussion in case of pneumonia. There will be wheezing and crepitation in auscultation. Okay, so what are the complications of H1N1? So as I said just now, it can either cause local damage or it can spread to other cells. If it causes local damage, it can cause airway inflammation. It will damage the airway of epithelial cells and it will cause airway hyperreactivity. And this will result in exacerbation of bronchial asthma and also COPD. Or it can spread to other cells. If it spread to other cells and go to the lower respiratory tract, it can cause alveolitis. It will damage the alveolar epithelial cells and endothelial cells, which will cause pneumonia or ARDS. And if it enters the bloodstream, it can cause extrapulmonary manifestations such as sepsis and also seizure. Neurologically, it can cause seizure because of the fever. In few articles, there are also Reye syndrome, which is also quite common in H1N1 because of use of aspirin. So the aspirin will actually cause Reye syndrome. Reye syndrome is encephalopathy plus liver damage. So this aspirin will actually interfere with the mitochondrial oxidation. So it will cause Reye syndrome in the children because the usage of aspirin as their medication. Okay, so for the H1N1 investigations, we have real-time RT-PCR, rapid influenza antigen test, immunofluorescence or ELISA, and also viral culture. The gold standard are RT-PCR and viral culture. So for prevention and management, for prevention, we know that it can infect swine to swine, swine to human, and human to human. For swine to swine, how we can prevent it is by using disinfectants to control the virus in the environment. For swine to human, we can prevent it by the usage of face masks, especially who have close association with the pigs. For human to human, we can prevent it by frequent hand washing with soap or alcohol sanitizer and disinfecting the household. The best preventive mechanism is by getting a H1N1 swine flu vaccine. So for Islamic perspective, I think getting H1N1 flu vaccine is in accordance with our Maqasid Syariah, in which it prevents it can help to prevent more morbidity and mortality. So it preserves the hifz al-nas, preserve the life. Okay. So for management, we have supportive management and antiviral therapy. For supportive management, there will be rest and oral hydration, and also treat for the symptomatic treatment, for example, antihistamine for nasal congestion, paracetamol for the headaches and body aches. We can also give antiviral therapy in case of people who have high risk for complication. For example, neuraminidase inhibitor, oseltamivir, zanamivir, and peramivir, and also M2 inhibitor, amantadine and rimantadine. Okay. So let's go for a brief case history, what you can expect in an influenza case patient. So an 8-year-old boy, primary school student, complained of fever, cough and wheezing for 2 days. The boy began to experience irregular fever with no known cause 2 days ago with a body temperature up to 39 degrees Celsius. Other symptoms include paroxysmal cough, expectoration of yellowish thick sputum in a small quantity, runny nose, wheezing, shortness of breath, chest distress, dysphagia, occasional abdominal pain that aggravated when coughing, and was small surgery around the navel. By physical examination, the body temperature is 37.9, heart rate 117 per minute, which is high. Breathing rate is 33 per minute, also high. Blood pressure 105 per 60, which is normal. Lips no sinuses, pharynx apparently congested, no follicular hyperplasia on posterior pharyngeal wall, no white spots, degree to enlargement of both tonsils due to infection. And by auscultation, there is a small quantity of fine morsels and wheezing in both lungs. And the patient reported a history of contact the patient with fever symptoms. So my different diagnosis would be influenza because the patient had history of contact and also he had flu-like symptoms. But we cannot also ignore other flu-like symptoms which are present in other diseases such as COVID, adenovirus, Kawasaki disease. Yeah. Okay. So I think it's important to ask whether the patient had history of contact with person infected with influenza or not. I think that's all from my part. you have any question?
It is an important another disease which we need quarantine, which are very important, especially from the patient who are susceptible, like pregnant women, like another kids, especially newly arrived baby, are very important to do quarantine for the child. Of course, investigation will guide us. We have the same like results, or like the same COVID, particularly like that. We can do. Also, we have respiratory panel, known as RBT. We done for about 35 virus and some bacteria. So all this one is expert. Sometimes we can add visit COVID or without COVID. It's just a nasal swab. We check for about 30 plus viruses and we can give you the virus which the patient already infected with. If it is very important to remember that many of these viruses need supportive treatment. So sometimes the admission and giving the IV fluid is an important indication. Okay, so please concentrate on this issue and always remember, as I told you from the first day, to go through that.
Doctor, I am sorry. We are online and we cannot hear your voice clearly.
Oh, they said they cannot hear your voice clearly. I think because you're
My
quite
voice is
far.
not clear. Nothing clear now.
Wait. Nampak. Sini tu.
If I turn the light off, no one knows to speak. Anyone really sleeping can stand up. Okay, am I clear? They can.
Yeah, they can.
Can you make the voice? Can you hear me now?
Yes, doctor.
Yes. Did you hear the first comment for the first presentation or not? Okay, just I need to tell you that the suspicious for diagnosis of the patient are very important. Okay, as you are starting your journey for the clinical practice, okay, so always put in your brain what is the differential diagnosis, how can we differentiate, and don't forget that some diseases which are endemic in our area, you must know it from A to Z. No excuse for that, please. H1N1 are very severe disease, can infect another people who is relatively immune compromised. Okay, so we must take care about quarantine for these children. Okay, please take care of these notes and how to decrease the droplet infection, okay, by distancing and by face mask if needed, like that, with the same which we did with the COVID-19. Okay, as I speak before, to know the sequence of the disease and its different stages will allow you to predict what is going. So you need just to communicate well with the family. Our role is not just to be a doctor to diagnose and write prescription. We must do the social job with us. So we need to educate the family, to sit with them, to say we are suspecting it to happen, blah, 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 this stage, so the family are known and do not feel in trouble of this one. Also, knowing these phases will help you to diagnose the disease and predict what is going after that. Remember, our rule for vaccination are very important, okay? Because now we can hear there is some anti-vaccine people who try to decrease the importance of the vaccine and erase the issue that this is my decision, this is my preference. we need to tell them this is a common benefit, not for the one alone. And there is something known as herd immunity can come from if like 90 plus of the people are vaccinated already, most of the community already protected. Of less, there is susceptibility. So it is very important also to be able to convince the people for their benefit. Maybe someone tell you no need for measles. And we can see now the vaccination is not 100%, we just see the percentage. So it is most important place to do your role and to try to ask what is the thing which make them worry about that. Some tell you it may be include alcohol. Tell him, okay, let us come and ask. The fatwa, we are not drinking this vaccine, it can for injection. And if we are strong, we can, if we can, we do it without alcohol, let us do, but we cannot do because we are bringing it from developed country who's doing everything for us and we only eat and like that. So it is very important to define the problem and try to touch it softly. We are not allowed to attack anyone, but try to convince him for the benefit of himself and for the community. Who is the second, third presenter? You, okay. And the first one,
Okay, I will continue present about the COVID-19. Okay, this the content of my presentation. First, I will go for introduction, pathophysiology and causes, symptom, population investigation, prevention, diagnosis, and the management of the COVID-19. Okay, firstly, for the introduction. So the COVID-19, as we know, the COVID-19 is the coronavirus disease 2019. So it caused by the severe acute respiratory syndrome coronavirus 2, SARS-CoV-2. And the first reported of the COVID-19 is in the Wuhan, China on December 2019. And the WHO declared COVID-19 as global pandemic on March 11, 2020. And it will cause the respiratory symptom to those who are infected with COVID-19. And next, let's see the causes. As I mentioned before, the SARS-CoV-2. So this is an example of the shape of the SARS-CoV-2, which is it has prominent cloud shape with protein spike in the form of corona and the crown-like surface projection at the external surface. That's why we call this as a corona-like, because it looks like a crown. And the incubation period is about 2 to 10 days and the mean is 5 days. And the transmission for the COVID-19 it can be via the respiratory droplet, contact with the respiratory secretion and also saliva and also aerosol particles. And it very effective in human-to-human transmission. So there are a lot of variants of the COVID-19 and this I just list down the common one. Next, let's move to the pathophysiology of the COVID-19. Firstly, the first one is the binding of the inhaled SARS-CoV-2 to the selected respiratory cell in the nasal epithelium via the ACE2 receptor. So the SARS-CoV-2 will bind to the ACE2 receptor and it will cause the viral replication and local propagation with a limited immune response. So at that stage, in most of the person, the containment of the infection with viral clearance in about 80% of the patient. Means most of patients will recover at that stage. So they will be back to normal after the quarantine and so on. So next, in 1/5 of all patients, they will develop to more severe, which when it involvement of the conductive airways, upper respiratory tract, and migration into the lower respiratory tract. So after then it will impact invasion of the infection and also the infection of the type 2 pulmonary alveolar epithelial cell via H2 means it will invade the cell in the lung and cause two, which is first one, it will cause the release of more cytokines, cause cytokine storm, and the second one, it will cause the viral replication. So I will go for the cytokine storm first, which when more cytokine are released, it will act as chemoattractant to the neutrophil, CD4, and also CD8 cells, along with the B cell differentiation. So the sequestration of the inflammatory cell in the lung tissue with the CD8, it will mediate the cytotoxicity as well as lung injury. Then the last one, it will cause the acute respiratory distress syndrome. So for the second one is the viral replication. When it invades, it will cause the viral replication and also the release of viral particle will result in the apoptosis of the host cell. So it will continue do the replication and infect the adjacent healthy alveolar epithelial cell and will cause loss of the type 1 and type 2 pneumocytes. So when the cell in the lung is injury, the last one, it will cause acute respiratory distress syndrome. So the acute respiratory distress syndrome occur when the lung is severely inflamed and from the infection and persistent injury of the lung cell. So the inflammation causes the fluid from the nearby blood will leak into the air sacs in the lung, which is the alveolar, cause alveolar edema, and the last one, it will cause hypoxia to the lung. Okay, next, this is the common symptom of the COVID-19, like the fever, chills, cough, shortness of breath, fatigue, myalgia, diarrhea, nausea and vomiting, sore throat, runniness, loss of taste or smell, and also the headache. So next for the complication of the COVID-19, it can be the pneumonia, ARDS, which like I mentioned before, the cardiac injury, arrhythmia, multi-organ failure, acute kidney injury, liver dysfunction, and septic shock. So I think it involves the other organ maybe because in children, the severe complication, it will cause multi-system inflammatory syndrome in children. So it will cause the other organ also have problem in severe cases. Okay, next for the investigation. So based on what I read, it says that in survey of children, some of children will have low white blood cell and also lymphocyte count will decrease. And next, the C-reactive protein and erythrocyte sedimentation reaction and also calcitonin also will elevated due to the inflammation. And for the liver function test, it causes the level of liver and muscle enzyme and myoglobin will increase also, like the lactate dehydrogenase and aminotransferase will increase maybe due to the inflammation of the lung as well. So next investigation is which is the most common, as we know, the RT-PCR and also the RT antigen test. So for the RT-PCR, we use to identify the presence of the virus genetic material, which is the RNA, and for the RTK, we to detect the specific virus protein antigen. So both will positive if the person was infected with the COVID-19, but for the RT-PCR, it was the gold standard with high sensitivity and high specificity. But for RTK, it only high in specificity only. So the disadvantage for the RT-PCR, the risk of mutation in virus cause false negative, and for the RT it has poor sensitivity. Next for RT-PCR, the result will come up in the same day or up to a week. And for the RTK, we will just get the result within 15 to 30 minutes. And both are able to detect the active virus. So next we go to differential diagnosis of the COVID-19. So we have the adenovirus infection, bacterial pneumonia, rhinovirus infection, influenza, respiratory syncytial virus, and also severe acute respiratory syndrome. So this is the differential diagnosis, which is it just caused by other virus, which because they will have the same symptoms sometimes. So we need to do some investigation to rule out the differential diagnosis. Next, we move to the management of the COVID-19. So it does not have any specific treatment, just we give the supportive treatment. The first one is supportive treatment, which is like the bed rest, oxygen therapy, and we treat the symptom like we treat the cough, fever, and so on. The second one is antiviral agent, which is like remdesivir, which it can be used to infant like within 28 days and at least 3 kg children. And next is immunomodulator, which is tocilizumab, which we can use to blunt the hyperinflammation, which caused by the cytokine storm that I mentioned before. Next is antibody-directed therapy, like the monoclonal antibody effectiveness. So for the prevention, we have vaccine, which is Pfizer, can be used to children around 5 to 12 years old. So next, we move to how to control the outbreak of the COVID-19. The first one, we have the crisis supervision by the Infection Control Authority and specialized agency. So as we know, in medical, we have an on-authority team to investigate about the COVID-19. So they expert in COVID-19 and they have more knowledge about it. So in Islamic perspective also, I will mention in Surah Al-Hujurat, or you will have belief, if they come to you disobedient one with information, investigate, lest you harm a people out of ignorance and become over what you have done, regretful. So it means that if we have information, we need to investigate, like we have a team that know more expert about it. So we need to ask them about the correct information. Second one is the hand hygiene, general hygiene, and also personal protection. So in medical, we know that we have 5 moments of hand hygiene, like before we touch patient, after touch patient, and so on. So in Islam also, the hadith say that Muslim is encouraged to do hand washing 3 times a day, 3 times, rubbing their finger joint, and also hadith also say that the cleanliness is half of it. So we can correlate that the Islam also encourage us as a Muslim to do always take care of our hygiene. So we can if the instruct to us to do hand hygiene and so on, we have practices all in our day. So we can do it more easily because we already practicing it in our day. The third one is the consulting specialist and seeking early medical treatment. So we need to consult early to provide the correct knowledge about something like in the COVID-19, we know the correct knowledge about the COVID-19 and so on. So in Al-Quran also, I will mention in Surah An-Nahl, verse 43, meaning, and we send not before you except men to whom we reveal, so ask the people of the message if you do not know. So we can see that Allah also encouraged us to ask the person if we don't know. Okay, next. Next is comprehensive care, including social, financial, and psychological support for patient and family. So as we go through the COVID-19, there are a lot of financial aid and also free medical treatment to those who infected with COVID-19. So and also hadith also say that encourage Muslim to say optimistic words. So we will have optimistic environment. We can fight the COVID-19 more easily if we have positive surrounding. Next, next is guideline in the event of limited resources. So for this, we need to limit our movement outside of the patient room and use alternative PPE when, like before we have limited of PPE, so we need to have the alternative PPE and so on. So I think that's all.
Next is travel ban, home isolation, and also the quarantine. So just I think there's a prophet say that when you hear that a plane in a land, do not go to it. And if you live in the land, and if you already in and do not leave it, means we need to stay in our state and we come out if we are in the state who have the plague. Okay. And the last one is integrated infection control strategies in the communities and healthcare unit. So we need to tell the society to always practice hand hygiene and also practicing the social distancing and so on to avoid the spread of the COVID-19. And also in healthcare, also we need to know the sequence of doffing or donning of the PPE and so on, so we can avoid from the spread the COVID-19 to other people. Okay, I think that's all for me, and this is my references. And thank you.
Thank you. She's able to concise how many million this now? How many million this from COVID now? 6 million? That is the mortality more than 6 million. Is very big number. So this one gives us an important to please be deep in your practice. You must be very professional to know all details. You know that some doctors, Dr. Hisham and the other, they are able to lead the initial COVID time and they put the 30% of the world you can control the pandemic. It's very important. This is the point. So you must be ready. You don't know. You don't know what is the days coming before all creature. Especially there is unfairness and there is a lot of breach of those of Allah like that. So we can suspect anything, but we must be ready. We are not just telling you you'll be a good doctor, you will be a doctor for the need for any emergency. This is an example. You still live in COVID-19, but with this severity and severity. You need to ask your colleague any questions. Okay, don't forget your PPE. Personal protected. It's stages. Level 1, level 2, level 3 are very. Okay, thank you.
Stop sharing or share.
Start share.
Start share.
Your community need to present.
Is me
Assalamualaikum, can you hear my voice? Assalamualaikum. Boleh dengar tak? Can you guys hear my voice? Dengar? Okay. Assalamualaikum warahmatullahi wabarakatuh. My name is Izni Anik Nubli bin Saiful Nubli. With my mention number is 2013695. So today I'll be presenting about HSP, which is He Not Shunne Pupura. So the short word is HSP. So next. So this is the table of content. It has 10 contents that I'll be presenting today. So let's go one by one. So the first one is the introduction. So Hinoxylene purpura is known as anaphylactoid purpura, and it is due to small vessel vascularities of the skin, joints, kidneys, and GIT. And it is characterized by IgA deposition in the small vessel. So next is the epidemiology. So it is most common in happen during childhood, but it can also happen in any age, and the most peak is between age 3 years old until 15 years old. This is based on what I've read, and the incident happens peak at 6 years old, and it is twice common in boys compared to girls, and it happens peak during winter, which means that the number of cases is high during winter not in Malaysia, I guess in the overseas. So next is so next is the etiology. So the underlying cause it remains unknown, but it preceded by upper respiratory tract infections, and and group A, and it is caused by the group A Staphylococcus and genetic predisposition. And next is pathophysiology. The pathophysiology for HSP is first is exposure to the antigen, and then it will stimulate the IgA production, and then after that, after IgA is stimulated, it will deposit in the IgA immune complex in the vascular wall, and it will activate the complement, and lastly, it will cause inflammation, which will be either two, which is IgA vasculitis or IgA vascular nephritis. So next is the clinical features. First of all, I would like to say sorry because there should be so many features, but suddenly things went wrong. So the first clinical features for HSP is, of course, the first one is rash. It can be from 95 to 100% overall of the skin, at the buttocks, excessive surface of the arms and legs and ankles, and at the area of the trunk is usually it will be spread, which means it will not usually get infected. When initially it is urticaria, and then it will go to maculopapular, and then lastly it will become palpable purpura, which is non-balancing. Next, the next clinical features is the arthralgia or arthritis. It usually happens in 75% of the patients, and it usually affects large joints of lower limbs, such as knees and ankles. And next is it occasionally happens on the upper limbs and usually cause periarticular edema, and usually no significant effusion or warmth happen during arthralgia or arthritis. So next is GIT involvement, which is 60% in the patients will have will have the problems with the GIT involvement, which is the first one is colicky abdominal pain. Next is hematemesis and melena. It only happens if the GIT if the gastrointestinal PTK develops in the patient. And lastly, for the GIT involvement is if the patients start to vomit or start to feel nausea. And the next is renal involvement, which is 50% in the patients will develop the symptoms, which is caused by the glomerulonephritis. Patient will have hematuria, either micro or macroscopic, and mild proteinuria. And the others could be subcutaneous edema and scrotal edema. So next is the investigation for Hinosh-Schönlein purpura, HSP. There are 7 that I've listed here. So the first one is full blood count, is to investigate if the patient have anemia, leukocytosis, and to look for normal platelet count. And next is coagulation profile, to look for normal proton beta M and APTT and FDP. And the third one is urine analysis, is to check whether the patient has hematuria or proteinuria. Next is ESR and C-reactive protein. If it is elevated, it means that if it is elevated, it means that there's inflammation ongoing in the patient. And next is renal profile. We need to look at the patient's renal profile to check for increased BUN or creatinine levels. And the second last is IgA levels. If it is elevated more than 50%, it means that there's high likely chance for the patients to have a HSP. And lastly is abdominal ultrasound to diagnose intersusception. This is one of the complication for the HSP. So next is differential diagnosis. If the patient develop signs and symptoms just like patients who have HSP, rash, arthritis, abdominal pain, and so on, which I've listed just now, it can be one of these kind of diagnosis too, which are immune thrombocytopenic purpura, thrombotic thrombocytopenic purpura, hemolytic uremic syndrome, systemic lupus erythematosus, and IgA nephropathy. So I don't want to go further about the differential diagnosis. So next is the complication. This is what I've said just now regarding the intersusception. This is most common happen in the patient who has HSP, Hinosh-Schönlein purpura, which means that some part of the bowel is intersected between proximal and the distal part of the intestine. So next is ileus. Third one is protein losing enteropathy, nephrotic or nephritis syndrome, and lastly is hypertension. So the second last is management. So I found 4 management that could be done for patients who develop HSP. So the first one is supportive therapy. It is for patient who develop rash, malaise, fever, and the supportive therapy could be sleep monitoring, energy and maintain good hydration. It is because based on what I've read, the HSP will go away by on its own. So without any medication, it will heal by itself. So if the symptoms developed by the patient is not very severe, so the patient and the doctor may discuss for supportive therapy. So next one is the NSAIDs. It is for patients who develop arthralgia or arthritis, and there's caution that need to be taken for patients, which is patient with renal insufficiency. And the third one is systemic corticosteroids, which is prednisolone 1 mg or per day for 2 weeks. It depends on the severity of the HSP itself. Usually for patients with abdominal pain, subcutaneous edema, and nephritis. And lastly is immunosuppressive therapy, which is azathioprine, and cyclosporine. It is usually used for patients who develop acute nephritis in HSP. And lastly is the prognosis for HSP, inosinate purpura. So HSP is generally a benign disease with an excellent prognosis, and HSP is more than 80%. 80% patients have a single isolated episodes lasting for a few weeks, which means that the HSP is prolonged, and approximately 10 to 20% of patients have recurrence. And next is fewer than 5% of patients develop chronic HSP. And last but not least, abdominal pain resolve spontaneously within 72 hours in most patients, which means that most patients even though it is most common for interstitiation to occur in patients with HSP, but usually it will resolve by itself in certain hours. So on the right side is my references, what I use to present to you guys today. So these are my references. So I guess is there any question you guys want to ask? Well, if there is no question, I presented Dr. to give any comments. Okay. Sorry, Doctor. You are being muted.
Can you hear me now? I mean the other colleague.
Yes, doctor.
Okay, so the last slide are very important because we for Henrich-Line purpura we have a lot of clinical lessons. Okay, the first one for the Henrich-Line purpura, it is disease of exclusion. There is no diagnostic test, but if you need, you must go for skin biopsy. Yeah, which is not mentioned during your presentation. The diagnostic can be a skin biopsy, which most of the area didn't go because clinically we can diagnose. That's why the ability to exclude other disease is another part of the art of differential diagnosis. Okay, it is very important. The second one, the word of purpura are very important, which means What does it mean, Anik?
Yes, doctor.
Non-blanching rash. I mean, I press on the rash, it is still there. Ideally, I must bring like microscopic glass and put it, still I can see. For the viral, it will, once you press, it blanch. But here, it is still there. If you find any unblanching rash, you must be very cautious. It can be hereditary berbera, it can cause severe infection like meningitis with meningococcal septicemia, okay, and a lot of differential diagnosis. So it is very, very important. Where is the slide? Why you close your slides?
Sorry, okay.
Because it is very important to put some comment about that. How to counsel the family is an important lesson. Because as you see, hereditary berbera is usually self-limited disease, rarely cause complications, need only follow-up, and the results are assuring. But here is the point. I asked you before to do an effective communication with the family. To do effective communication with the family, you must be able to be knowledgeable, understand the person you are speaking to him. He may be staff of medical, he is the one who doesn't know anything about medicine, so you must understand how you are handling the situation. They are high educated or low education are very important. That's why I see some doctors, when they are try to speak to the patient with hereditary berbera, the first word, don't worry, mom, your baby will be okay. It is a simple disease. It is different. If you said like that, most of the family will not come back for the follow-up. And we know that the microscopic hematuria can stay for 6 months. And we are afraid of hypertension can occur. We are afraid of there is kidney injury, in spite it is very small amount, less than 5%, okay, can get kidney injury. So we need to follow up. This is completely different. To say, please, the disease is known to have as overall good prognosis, but we need to see the child regularly for at least 1 year to make sure, okay, about his blood pressure, about his kidney function, about his hematuria, because some of these patients will continue to go this, even some can go for renal insufficiency or like that, okay? So please don't give blanket assurance for any patient, because they are very happy to go and then the doctor told us about that. No, it is not like that, please. And at the same side, don't be over giving even pushes until you let the patient to give up of hope. Please don't do that. It is not your job at all. Allah subhanahu wa ta'ala will make them patient if you are more professional. Whatever, because you will sit in your clinic or in your hospital and come to your diagnosis with leukemia in children. Do you know what is leukemia in children? It may be very nice boy or nice lady, which is just a few years. And then you tell them she has leukemia, we need to start chemotherapy, the hair will fall, and we will be isolated because of neutropenia, and they can get infection, and. How to proceed with this one? You got the touch of Islam, okay? How to handle this situation. You are not a doctor to be superior, no. You may be a patient at certain time of your life. Maybe your father or mother or brother or sister or son can be the patient. So deal with this thing. How to be soft touch with the patient. Sorry, always say this word. معذرة by Arabic, sorry by English. It's my job just to declare some point. You are coming today to ask about the result of the bone marrow. Yes, tell us, doctor, what is going with the bone marrow. So it's just be patient and prepare some tissue. It may be the family need to cry. Don't tell them your baby has leukemia. We need to start chemo. We need to do as if you are have kicking many times for the one in front of you. No, you must carry, please, heart in your body as a doctor. The doctor without sympathize heart, he is near to hell, not to Jannah. And remember this, please. Try to remember that it is very easy for a doctor if he أحسن العمل يبلغكم أيكم أحسن عملا. Every patient coming to you, try to do your best as a professional and as a communication and as the one who give hope, not fed up. You can speak now. You can see that the prognosis for the acute leukemia, it is very good. About more than 95% will survive if they follow up the treatment. They are better than COVID and the other disease. Here, if you are trying to give, please, any negative point, try to put one positive beside it. So compensate on the heart and in the brain of the other. Don't worry. Don't worry, yes, we have a severe disease. This is leukemia. This is whatever we are diagnosed in our, this is nephrotic syndrome. This is every disease, thalassemia, nothing. Alhamdulillah, we are here to give you cure, okay? And the result will be good like that. The only thing we need to go for the treatment. And please, we are not doing is at the person. There is a complete team will be in support for you, okay? Multidisciplinary team for care of any child. We make the life easy for him. We're giving a treatment, and we have some photographs of previous patient with this disease, what happens and how he is now, and he's still coming to our clinic, and he is a good. Another one, like one with cleft lip and the palate, and when you see the baby, you are very afraid, and tell them this is the photo after we repair. That is the way. That is the way. We are not a God. We are not superhuman, but we must be professional one and have a soft touch in speaking to the others. And make sure that Allah said, or the Prophet said, Al-kalima at-tayyiba sadaqah. If you said a good word, as if you pay some money for the other. If you tell him a good word, it is sadaqah. Allah said in Quran, وَقُولُوا لِلنَّاسِ حُسْنًا. حُسْنًا, the best word. And even in other word, وَقُولُوا لِعِبَادِي يَقُولُوا الَّتِي هِيَ أحسن. You know, Hasan is a good word. Ahsan is the more and the best one. Sometimes you need to select the word. Be patient, don't give your opinion very rapidly. Be sympathize, prepare some tissue, prepare for the family, sympathize, bring one nurse beside you so she can support her and just cuddle her like that. It is very important. Am I clear? This is the issue. So remember that neither underestimate the disease and give false hope, and neither let the patient to give up from the future. I remember it is just 200 years plus, there was no known treatment for diabetes. And one of the kings like that, he started to go to these symptoms, and they used to send someone just to test the urine. If you find it sweetie, it means this patient has diabetes, and the only thing he told to him, it is maybe 2 years, you will be not here. This is the word. Now we have treatment about how percentages of Malaysian and even in developed country have diabetes, and they are surviving and doing well. And now they are thinking about stem cell transplantation to stop giving the medication, and because this is your also role in the future. Not to be in the same level of us. You must be upgraded. You must think how to be subspecialized. Don't hurry after graduation. Now I need to go for something which can give me money. Don't worry about money. Money already registered under you before birth. Before birth, don't worry. But try to give benefit for your country, to be specialized. Now we're speaking about infection control. We see what the team did during this infection control. We see for another problem in the country, we need all subspecialty. So from now, try to see what is your ambition and start early. You will, inshallah, be the best for yourself and for your country and your ummah, inshallah. Am I clear? I hope you got a lesson about many presentation today. If you need to ask me any questions. Okay, through online, any question? Arif, Athira, Ismi, all okay? Okay, see you inshallah. I have bedside teaching with another group today with you in HTA. Huh? Next week, not today. Are you sure? Okay, thank you. Assalamu alaikum wa rahmatullah.
Thank you, Dr.
Thank you, Doctor.
Thank you. Assalamu alaikum. Hello. Are you sure it is not today? Because I got a message. They are speaking about next week. HTA to my Minty group. Which day is on? Let's start teaching. Who is my group? My Minty group. You. We have today or next week for the HTA. Sorry.
It's year 5.
Year 5? Oh, it may be year 5. My Minty in year 5. No, I must settle this one first before I give you marks. Should I go or not? Is Auntie? Oh. Okay. You will ask Sister Farah to send me this presentation, please. Huh?